Now we have some questions. The question is, are these presentation slides available to view online? And yes, the answer is that they are, and they have been, you're doing a videograph. So they will be online. When will the results from the MINT study for AD phase 1 be ready for release? Håkan?
Is it on? Oh, probably in a year.
Don't hold your breath in the meantime, but the results will be coming. Are there any studies on metformin and its effect on Alzheimer's disease or other dementias? Robin or Håkan, do you know of any?
I am not aware of any particular one on metformin, but diabetes treatment are being studied on different medications, but I don't think metformin is. For clinical studies anyway, there are animal studies looking at metformin and Alzheimer's.
There is a lot of work on the interaction of diabetes, vascular disease, and neurodegenerative disease, and so it's a big area of special interest, that's for sure. A question for Dr. Nygaard. Is CARD involved in trials on interactions between anti-seizure medications and dementia? Are there any classes of drugs that improve or reduce cognitive decline in dementia patients, or slow it down, I would guess that means?
Is this for seizure medications in particular?
I beg your pardon?
Was this for seizure medications in particular? Yeah, there's one class of drugs currently in trials in Alzheimer's disease. It's a drug called levetiracetam. It's also known as Keppra. And there's been a lot of preclinical work supporting that as a therapy. There are currently no other treatments that are being considered for as a therapeutic intervention. We are not a site for Keppra, the Keppra trial at the moment.
This is a question directed to Jeff Small. Somebody, I guess, in the audience was trying out things already, but unable to find apps on Google or Apple stores. See app. So is there a quick, specific direction for people who want to start getting into these?
So they were unable to find the 4 apps?
Yes.
Okay. Well, we know that 3 of the 4 are still available. So we know that apps have sometimes a short lifespan, right? And so Communico Tool for the adult version is no longer available, unfortunately. But the other 3 apps are available as of a month ago. So if they're not there now, I don't know, it could be the way you're accessing it. And these are all iOS apps, or they are supported by Apple-type devices.
Thank you. There's a question for Brianna. Using sleeping medication, how does it affect the antibody compared with natural sleep?
So we actually don't know. There's not a lot of research looking at specific sleeping medications. They've done some research looking at anesthesia. So when you're put to when you're asleep during surgery and you're unconscious. And some seem to clear out amyloid and others don't. So we still have a lot of remaining questions, and we don't know how sleeping medication affects amyloid levels yet.
Thank you. I think this is the big question. Given the disappointing drug development program to date, and seeking a cure for Alzheimer's disease, could the approach based on amyloid and tau hypotheses be completely wrong? And do we need to have out-of-the-box thinking? So maybe Håkan and Robin would like to...
Maybe I'll take a first stab. I think it's a great question. I think it's premature to say that the hypothesis is wrong. I think the really important aspect of this is to actually test the hypothesis correctly. And the ongoing trials that are, the one that was reporting that I mentioned, the Merck trial, and some that are reporting in the next several years will test that hypothesis. So that's a really great question for the several years to come. And we all have that question. So even if it doesn't work in established disease, we haven't answered the question whether it will work in asymptomatic disease, so when you're 40 and 50s. And the last part of this is there is a lot of thinking outside the box. So we just mentioned a few of the most prominent trials, but there's a lot of thinking around and outside of this amyloid and tau box. So stay tuned. But there is a lot of work being put into this.
Nothing to add.
There's a question here, how can a person with dementia participate in the sleep research? My suggestion is you fill out the form that you've gotten right in front of you if you're interested to be considered. And maybe, Brianna, you could touch on this one, the effect of sleep apnea on cognitive impairment, and the effect potentially of the treatment.
As a treatment? Yeah, so there is quite a bit of research looking at sleep apnea in Alzheimer's disease, because patients with Alzheimer's disease do seem to be more likely to have apnea. And the good thing about apnea is if it's detected, it can be treated. You can use with the CPAP or with other dental implants. It can be treated, and there have been shown beneficial cognitive effects when they have studied treating apnea in patients with dementia. So if you do think you have apnea or you suspect, talk to your doctor about it, and it can be treated, and there could be beneficial cognitive effects by treating apnea and also getting better sleep and more deep sleep if you treat apnea.
There's a question directed to Maria from Alzheimer's Society of BC, talking about, the question is really, for programs, how does research in the effectiveness of programs such as a Pulse Club or such as Minds in Motion, which is one of the big Alzheimer's programs, how does that affect helping to secure funding?
Great question. All the programs and services that are offered are developed based on research, and we do look to ensure that what the services are available do have evidence that there is a difference. And so research and funding come hand in hand and aren't just necessarily for the biomedical element of research, but certainly quality of life and quality of care. And dollars that are donated can be designated for that. And certainly through the Alzheimer's Society Research Program, there is a category for quality of care, and dollars do come into that significantly.
Thank you. And Jeff, there's a question related to how long the benefits of the training were effective. And are the training manuals now, the SRM training manuals, that now available for public distribution?
Okay, the latter question, no, they're not ready yet, but you can follow up with me and see if in the near future we can get something, or perhaps get something to you in a draft form ahead of time. Regarding the longevity of the training effects, our study only looked at it 2 or 3 weeks post-training, but other studies have used this technique and have found effects lasting as long as 1 year, especially if there are booster training sessions periodically during that intervening time, so every few months having a retraining session.
Now, this is an interesting question. Perhaps Robin and Hakan could consider it, but people with dementia often develop an insatiable appetite for sweets, even if they didn't previously like sweets. And we've seen that with frontotemporal dementia, for example. But how does this influenced by how glucose uptake occurs or sugar uptake occurs in the brain? Especially, you were referencing the PET scans.
So I probably, or we as a group probably shouldn't refer it so much as to sugar uptake, although it is sugar uptake, but it's not in the same sense. So when I talk about sugar uptake, sometimes people say, well, if it's a problem taking up sugar, why don't you just eat more sugar, right? So it's not like that. So there really isn't, as far as I know, and maybe you can comment, Dr. Cheung, but there's no correlation between your sugar intake and how the brain takes up that sugar. It's a completely different mechanism. So in that sense, it's a completely different mechanism than diabetes, for example. It's not the same. So I would say there's really no, even though it's tempting to speculate, there's really no correlation.
And there are many, the point is there are many kinds of sugars. There's the sucrose, the fructose, the glucose, etc., and different sugars for different problems or solutions. And final question for Marie, are there any physical changes that a municipality can make in order to be more dementia-friendly?
That's a great question, and the answer would be yes, and depending upon which municipality you're talking about, there are a number of changes. One of the really fun changes is that the City of Sydney has really gentrified their front boardwalk, and they've done a mixture of very aquatic or nautical sculptures, but also then putting in very plain benches and things that people with dementia can easily identify for a rest. In Vancouver, certainly the number of parking spots are starting to increase with disability parking spots in front of doctors' offices, which is might not be noticeable to the public, but there certainly is an increase in that. Also, the community centers in the redesign are beginning to much more add in elements of visuals in terms of signage and ramps to again take into consideration for dementia. So it is becoming more apparent. It's slow, but it is there.
Thank you. And the last question I'm going to put out here is Dr. Pat McGeer and Dr. Edith McGeer have been working on various studies in dementia for many decades here at UBC and have made so many contributions to the literature for Alzheimer's disease and related disorders. Question for comment, what about their work with ibuprofen, which is a non-steroidal anti-inflammatory?
So, Dr. McGeer has done a lot of very interesting work on looking at inflammation as a cause or a participant in the neurodegeneration process. So that is still being investigated because inflammation is not so simple. It is essential for our life to fight an infection when we have a bug, like a virus attacking our body. Our inflammatory response will get rid of the bug. So on the other hand, there's clear evidence that inflammation is mediating part of the neurodegeneration. But it's not the same inflammation because that's more of a very slow background inflammation that it's involved in the neurodegeneration process. And how do we tease it out to stop the slow degeneration process without harming our ability to defend our immune system? It's still not very clear. So ibuprofen is commonly available. There has been a lot of proposed studies. It has not been supported by most of the funders because it's very expensive to run a good clinical trial. But similar studies that Dr. McGeer may argue are not the right medications have been studied. For instance, there is one of the felbinate, I forgot, one of the anti-inflammatory that's in the same class in ibuprofen has been studied. I think naproxen has been studied, and those have been negative. So by similar inferences, we don't think ibuprofen will be any different, at least for the established Alzheimer's disease. Whether it can prevent it in the early stage before people have Alzheimer's, that's a different question. But no other studies have looked at that, and that's a very difficult trial to design. But anyone who has the idea to think about it will be happy to entertain.
Well, suffice to say that Dr. Pat McGeer takes it every day, and he is very overt at telling everybody about that. But in addition to that, he plays tennis regularly. And don't forget that exercise has been shown quite nicely to be as effective as the interventions, other kinds of interventions that we've had so far. And don't forget, having a good night's sleep is helpful. I want to say thank you very much to our speakers this morning. We've nibbled into the coffee break, and I think that fortunately the organizers here put an extra 10 minutes in the coffee break, especially for this reason. So